dermal fillers are injectables that will actually help to correct the wrinkles due to folds around the face. And the most common types of dermal fillers are actually made from HA or hyaluronic acid. How hyaluronic acid works is that it can absorb up to 200 times its weight of water. And this is how it retains the moisture inside the skin. For Restylane, it is unique in that its HA is made using the patented NASHA technology. By comparison, the NASHA technology ensures that the HA molecules are stable and will perform its function well to absorb water. So Restylane is the first brand in the market to launch the Skin Boosters range of products, which is used to hydrate and repair the skin. By comparison, another brand of skin boosters is Profhilo, which is also used for skin hydration and skin thickening. So how Restylane dermal filler works is that it spreads very easily under the skin after injection. So it gives a very natural looking results to handle things like fine lines, wrinkles, deep folds as well. Okay, the benefits of using dermal fillers like Restylane is that it can improve fine lines and wrinkles, improve the volume of the face, like the cheeks area, the temple areas, the marinate lines. It also helps to reduce wrinkles around the neck and the décolletage areas. It is often used to improve contour of the face, such as being injected on the nose bridge, the chin, the upper cheek area to give a face a more defined look. So after injection, a lot of people notice that the skin is smoother and look more refined and plumped up. Of course, radiance also is important. Restylane that's injected near the eye area will improve the dark eye circle appearance as well. So typically, there's no limit on the number of areas that can be treated in one single session, but most of the time, we will not inject more than 6 tubes of fillers at one go so that the face don't look too swollen after injection. Fillers injections are nowadays not painful because the high quality fillers will come equipped with lidocaine built into this. Also, a very fine needle is used, typically 27 gauge, which is extremely fine that our eyes can hardly see it. A skillful doctor will also ensure the technique of injection itself can reduce the pain of injection. The common side effects are needle marks, redness and swelling where the injection has occurred, and of course a bit of pain. Some people with sensitive skin may have some bruises that can last about 2 to 5 days after injections. Occasionally, there may be lumps or nodules felt after injections, and typically they should go away within 1 to 2 weeks. A more experienced injector will have much less side effects because they will know how to adjust the depth, the speed, and the technique of injection. You will see visible results after a single session. The duration of the results will depend actually very much on a few things. Firstly, the density of the filler used, because Restylane has a few types of fillers with different type of density, and the cross-linked used. Secondly, it will be depending on the location of injection, because location of muscles that involve a lot of movement and animation, like the eyes, the mouth area, will have a shorter lasting result. So results can last anything from 4 months to 15 months, depending on which type is used. A touch-up is necessary if you want to see more lasting results. So sometimes you can do a touch-up about 3 to 6 months later. After that, the results can last for another 1 to 2 more years. Sometimes migration of the fillers may occur that makes the fillers look very different from when it was first injected. So how to prevent that? Okay, firstly, the patient must keep up your side of the bargain, meaning that please follow the aftercare instructions like do not massage or rub the areas of injection, avoid smoking and alcohol, which can speed up the breakdown of the fillers. Okay, next, it depends on the depth of the injection. If the injection is done more superficially, it tends to last shorter. A deeper injection tends to last longer with the right kind of fillers. Next, it will depend on the experience of the injector. So the injector done in the right location will also last much longer. Another reason it could be something that we couldn't quite help is actually the activity of the enzymes in the skin. So some of us has very active enzymes in our skin, and they will attack the fillers, which is biodegradable, to break it down. How to treat the migrated fillers? The most important and simplest thing to do is to return back to the doctor who did the injection for you to discuss with the doctor what to do. So at the doctor's clinic, what can happen is sometimes the doctor may add on a thicker or stronger filler with higher G prime to support the migrated filler. So this sometimes happens if the fillers has been injected, let's say 4 to 5 months ago, and you can add on a new fillers as a touch-up at a time. Another option is actually to start over. So the doctor can actually remove the biodegradable HA filler using this enzyme known as hyaluronidase. So after injection, the HA fillers will be removed and you can start all over again to inject the fillers. Okay, so fillers injection can cause bumps, especially if you have thinner skin. But typically the bumps will disappear after about 5 to 10 days. For some people who have very stubborn appearance of bumps, we can return to the doctor to take a look after about 3 to 4 weeks. Sometimes a slight massage will help, or you might need to do the enzyme removal of HA. So fillers can work on any scars. For instance, how it works is that because of the hyaluronic acid that's introduced into the skin, it actually retains moisture of the skin as well as help to stimulate collagen production. So as a result, the acne scars which is due to loss of collagen will appear much better and more filled up. However, maybe a few sessions may be needed depending on the depth of the scars. Sometimes we may add other ingredients as well to stimulate the acne scars collagen remodeling, such as Rejuran, PLLA, as well as PCL. Well, I like to combine Botox together with dermal fillers like HA because it's like 1 plus 1 equals 3. Reason being, we know that Botox actually treats the dynamic wrinkles caused by muscle cell expressions, and Restylane and HA fillers will actually treat the static wrinkles. So when you combine the two, the results are much better because the Botox will stop the muscle movement that can displace or break down the HA fillers. As a result, you get a more lasting effect. Botox and fillers can be done on the same day to create this good effect. So if you just had your vaccine, especially COVID vaccine, please wait at least 2 weeks before going for your dermal fillers injection. Similarly, if you just had your fillers injection, please wait at least 2 weeks before going for your vaccines. After injection, our skin will be a bit more sensitive to the sunlight, so do avoid going to the beach or sun exposure after having fillers injection. Therefore, it's important to apply moisturizer and sunblock after you had your fillers so that your fillers result will be more long-lasting and look natural as well. Right now, I'm going to introduce to all of us the various types of Restylane fillers that we have and how they work. Firstly, we can talk about Restylane Define. So Restylane Define is what we call a volumizing type of fillers. So it is good for treating areas that are sunken or has deep skin folds, like the areas around the cheeks, the temples, the marrow line areas, or even the side of the cheeks if the sunkenness is intense. So next we have Restylane Lift. Lift is what we call a structural type of fillers. So it is good for contouring the face, like the nose bridge, the tip of the nose, the cheekbone, as well as the chin as well. So Skin Boosters actually contains lower concentration of hyaluronic acid, but it also still contains a cross-linking molecule to slow down the breakdown. So Skin Boosters can be applied everywhere on the skin to make the skin more hydrated as well as thicker. Compared to fillers, Skin Boosters takes time to work on our skin. Reason being the quality and the quantity of the HA inside Skin Boosters are much thinner and finer compared to fillers. So you can see immediately visible results after the first session, but as you do the second and third session, the results become more and more significant and natural. What also happens is the hyaluronic acid that's injected into the skin actually helps to stimulate collagen production and also maintain the skin hydration and quality. So with time, the results get more and more visible. Therefore, the recommended treatment sequence is the first 3 to 4 sessions is done 4 weeks apart. Subsequently, you might need to do it about 4 to 6 months apart depending on your skin quality, the climate that you live in as well. Lidocaine is a very important ingredient added into dermal fillers, especially Restylane, because it reduces the pain sensation during injection. Okay, so you shouldn't have this done if you are pregnant, breastfeeding, or have sensitive skin such as inflammatory or infective skin conditions. If you have a known allergy to hyaluronic acid or lidocaine, you also shouldn't have this treatment done. Next, if you have bleeding disorders or is taking a blood thinning chemical or medication, you should also postpone your treatments until the medication is stopped or your bleeding disorder is under control.